It is now my distinct pleasure to welcome our keynote speaker. Oh, can't hear it. Okay. It's my distinct pleasure to welcome our keynote speaker, Dr. Williams. He's a professor of neurology and neurological surgery at the University of Washington, but he is homegrown here. He got his medical degree here at Indiana University School of Medicine. He serves as the director of the Adult and Transitional Hydrocephalus and CSF disorders, and he has expertise across many forms of hydrocephalus. He has helped to create the International Society for Hydrocephalus and CSF Disorders and is past president of that society. He's a founding member of the Adult Hydrocephalus Clinical Network, and he's been very active in patient advocacy. Interestingly, he's also working with NASA, particularly on their spaceflight-associated neuroocular syndrome, which is a disorder that affects astronauts on long-term space flights. So it is my distinct pleasure. I'm intrigued by the title of his talk and looking forward to hearing his insights.
She just warned me the mic is on. Let's do this one, because I don't know about you, but we've had many quiet speakers and I want to be sure that you can hear me. So Bonnie, thank you for giving me an excuse to come back to Indianapolis. I haven't been on campus since about 2008, and before that I hadn't been on campus since 1989. I should probably tell you a little bit about my career. This is where I ended up. That's the view from our apartment in Seattle. Yes, that's the Space Needle there, and those are the Olympic mountains in the background. So I started my career in neurology and then became a neurointensivist at Johns Hopkins in 1989. So I'm actually from the first generation of neurointensivists out there. And it was from there that I developed my interest in hydrocephalus. First taking care of the acute forms of hydrocephalus in adults in the intensive care unit, but then starting with idiopathic normal pressure hydrocephalus, learning how to apply my understanding of the same physiology and pathophysiology to the care of patients with ambulatory forms of hydrocephalus. And I started with the elderly population, which is idiopathic normal pressure hydrocephalus, then young and middle-aged adults, and then eventually the transition population. So children who survive the neonatal ICU, children who have had 44 shunt operations, young adults who then get spit out, literally, of pediatric hospitals and have no place to go. And I actually led a conference that the Hydrocephalus Association had about 6 years ago to identify healthcare transition as a major issue. I'm looking at Mitesh here. We talked about this at dinner last night. So that's a little bit about my background. I had a side gig in biomedical ethics, I should say. I was co-chair of the ethics committee at Johns Hopkins Hospital for about 9 years, and actually chair of the American Academy of Neurology's Ethics, Law, and Humanity Committee. So there's my title, and let's just see if we can move a couple things out of the way here. Because if I can see it in the middle of my screen, I think you can too, or we'll make that disappear. So here we go, maybe. So these are my disclosures, and you can see that I get some research funding from NASA and from TRISH, who's not a person, but the Translational Research Institute for Space Health, to investigate ICP in astronauts. Spaceflight-associated neurocular syndrome looks like pseudotumor cerebri. Astronauts on long-duration spaceflight come back with papilledema. They don't have significant visual loss, but we're trying to understand whether there's abnormal ICP associated with it. Now, Mitesh, the NIH funding that I have is for the PENS trial. And you may or may not know that I actually wrote the PENS trial along with Mark Luciano and Jan Malm from Sweden. And it took us 14 years of work and a couple of visits with the NIH before we finally got it funded. Bonnie mentioned that I've been active with the Hydrocephalus Association and the Hydrocephalus Clinical Research Network. And oh yeah, I came from here, School of Medicine and neurology residency. So I tried to make photos from my copy at home, but I had to go online and find some pictures from the 1985 Caduceus. That's the yearbook for the School of Medicine. And there's Kyle going, yes, IU Northwest, because I went to IU Northwest for my first 2 years. I don't know who that skinny guy in the middle is. I think that's me. But the yearbook had only 2 of the neurology faculty in it. One was Bill DeMeyer. Bill was an amazing pediatric neurologist who taught that the history and physical exam is essential for everything that we do. And Mark Deichen was the chair of neurology at that time. He was a master in the field of stroke. So this is a talk that I've given now for the second time today. And I gave it a year ago at a large conference for primarily young investigators in the field. I thought a lot about how I can speak to young investigators. And can I just see how many of you are at assistant professor or lower in rank? So that would be residents or fellows or students and so forth. Come on, guys. I know you should be raising your hands over here. All right. So any deans in the room? I got a message for you too. Any chancellors in the room? Okay, I got a message for you too, and some department chairs and so forth. So this is, in fact, for all of you, but especially for those of you in the audience who are young investigators and at the early stages of your career, because I thought about my own career when I was putting this together. So I know you all thought that I was going to review the science. Well, I'm not going to do that. And I'm not going to tell you about all the papers I've written. I'll send you my CV if you want to see that. And I'm not going to propose a radical new theory of hydrocephalus. But I hope to inspire you. I want to inspire you to see hydrocephalus differently, more broadly. And I hope that each and every one of you will achieve great accomplishments with whatever role you choose to play in the world of hydrocephalus. That could be clinician scientists. It could be basic scientists, clinician researcher, modeler, physicist, working in Bonnie's lab, working in Becky's lab. And I want to invite you to ignore the naysayers. And those of us in neurology and neurosurgery know that there are naysayers with hydrocephalus. They go, is that all you can research, hydrocephalus? They really think that it's not worthy of study. They dismiss hydrocephalus as unworthy of serious study. They disbelieve in idiopathic normal pressure hydrocephalus, or they take care of patients and dismiss them and blame the problems on the patients, very contrary to the model of David Frim that you heard about earlier. And sometimes I think that ignorance and arrogance hurts people more than it helps. So if you're going into hydrocephalus, I want you to be loud and proud. I want you to be loud and proud that you are studying one of the most complex and poorly understood disorders of the brain that exists. Your work is vital and valuable. It's highly valued by patients and the families that we serve. And I want you to share the same joy. I'm a clinician, the same joy that I get when my patients get better, and to show empathy when they don't, because not everybody gets better. And to be joyful and proud when your research, it could be basic research, it could be something else, has the potential to change the lives of millions of people around the world. And I want you to be as optimistic as I am about hydrocephalus, especially with the launch of a new center here. All right, mandala. How many of you looked it up? How many of you know what it means? Okay, I know one of your postdocs is from Nepal. He should probably know what it means. So mandala is from the Sanskrit for circle. Now, from the Buddhist tradition, a mandala is a representation of the universe. And it can serve as a guide for introspection and meditation. And each mandala's design, representation, meaning, and purposes are a reflection of its creator. Now, I'm not a Buddhist. I'm from Indiana, Northwest Indiana. And I didn't really know about mandalas until 4 years ago, October 2019, when my husband Clifton and I took a trip around the world with National Geographic. And those are some of the pictures, and it really was an unforgettable trip. But two of our stops were in Kathmandu, Nepal, and Lhasa, Tibet. And walking through Nepal with our guide, we went to an art school. And we stopped and we learned about mandalas, and we actually bought two of them. They were the two I showed you in the picture a minute ago. And following that trip, and as I thought more about mandalas and what they represent, I eventually realized that I had created a mandala for hydrocephalus through the course of my career. It actually represents my thoughts and my visions about hydrocephalus. It guides me. It's my worldview, my universe, and I want to share it with you. Now, the creation of the mandala has lots of influences, and these are some of mine. I see the world through the eyes of a neurologist and a neurointensivist and a hydrocephalus expert and an ethicist. And my eyes and my perspective were influenced by many people through the years. Now, the mandala was something that I really was unaware of for quite a long time, at least the first half of my career. It was there, and maybe it was gestating, I don't know what, but it was latent. It was undiscovered until I was given the opportunity and the responsibility to change everybody's perspective on hydrocephalus. And that was the 2005 NIH workshop on hydrocephalus, the first ever NIH workshop on hydrocephalus. And the backstory is that Dory Kranz, who's second from the left in the picture there, who was the executive director of the Hydrocephalus Association at the time, had contacted NINDS and had arranged a full day of meetings with the staff and with the director of the NINDS, who was Story Landis at the time. And Dory calls me up and says, "Can you join me next week?" She gave me a lot of notice, but fortunately it was an administrative day for me, and I was able to make it down there with her because Bethesda was not too far from Baltimore, where I was at the time. And we were supposed to, at the end of the day, have about 20 minutes with Story Landis. She ended up giving us an hour of her time, and that's usually a good sign when somebody at that level gives you more time than you were expecting. And Story said, "Yes, you can have the workshop. Normally, it requires a competitive application." She said, "No, I'm going to give you the money to make the workshop happen." And so we got to work just a few months later with the staff from the NIH to make this workshop occur. And it wasn't just a US conference, we had international participants. But our motive from the very, very beginning was to intentionally and completely redraw the prevailing view of hydrocephalus, knowing that we would write a white paper and that would set a research agenda for many years to come. Now, I got to give a talk. I was in the first session. And on the left is actually one of the slides. This is the slide that I showed at the NIH conference. So orthodoxy. And the orthodox view, Mitish knows this, was that hydrocephalus was a disorder of CSF circulation and resorption. And since shunts had been invented in the mid-1950s, hydrocephalus was cured. We heard that all the time. Well, hydrocephalus was cured. And that's how everybody thought about it. It was a plumbing problem. And scans and shunts, and that's it. And if you have a cure, well then, who needs research, right? Who needs research? And so in my next slide, I said to them, well, you know, because I take care of these patients, shunts and ETVs are merely a means to an end. They're necessary. We need them to get patients better. But the focus on CSF circulation made everybody completely missed the most important goal of treating hydrocephalus. So then I told the audience, hydrocephalus is not a CSF disorder. And I think we heard one of the junior neurosurgeons say that today. It's a CSF disorder, but it's not. Hydrocephalus is a brain disorder. It's a brain disorder. And the most important aspect of hydrocephalus, and idiopathic normal pressure hydrocephalus is one of the best examples. You have somebody who has symptoms for weeks or months or years, and we treat their hydrocephalus, and they get better in days or weeks. And that means that there is a reversible neuronal and glial injury that's responsible for the symptoms and the recovery of symptoms. And this is very unique. There's no other disorder that's quite like it. So a unique form of reversible neuronal and glial injury. And so by asking 3 simple questions, what in the world is happening to the brain as a consequence of hydrocephalus? Why is it happening? And how do the injury and recovery mechanisms in hydrocephalus work? The mandala was born, and here it is. This is the slide that I showed at the NIH workshop. And remember, I didn't figure out it was a mandala until many years later. So I didn't call it that. I just showed the slide. But in a single image, it summarized the new universe of hydrocephalus that we wanted to promote as the basis for research and clinical care moving forward. Now, if you think I'm exaggerating, look at this. This is the white paper. On the right is table 1. Everything in that mandala is on table 1. It's really not very inspiring. It's just a list. Now look at that mandala again. And now you can see how each circle, each concept is related to the next. It starts at the top with reversible neuronal and glial dysfunction, reversible symptoms, injury and recovery mechanisms, down to laboratory and clinical models, surgical therapies, adjunctive therapies, eventually research. That's the circle of hydrocephalus. And you can see at a glance all of the concepts that we wanted to promote and all of the work that needed to be done. And you could see at a glance the complexity of hydrocephalus. And in your mind, you can see the potential for research bridging disparate concepts. In your mind, you can see where you and your work fit into the mandala of hydrocephalus. And since 2005, since I drew this, this is how I have seen the universe of hydrocephalus. Now, skeptics, and there are plenty of them, would say, well, isn't that nice? But has it done any good? So let me show you. So remember, Jack Walker and Pat McAllister, who Mitesh wrote his first paper with many, many years ago, and I worked with the Hydrocephalus Association on the workshop. Well, the Hydrocephalus Association is the largest patient advocacy in the United States, in fact, in the world, for patients and their families with hydrocephalus. And their members, like the Finlaysons, wanted better research to result in better patient care and better outcomes. And the Hydrocephalus Association has advocated consistently with the NIH and with the US Congress, which means the CDMRP, which is the source of some of Bonnie's work, to promote hydrocephalus since then. But here's the problem. To get an NIH grant, you need preliminary data. And you can't get preliminary data unless you have funding. And so the Hydrocephalus Association started to raise money for research. And we do this mainly through walks every year. Do we have a walk here in Indianapolis for hydrocephalus? I'm going to put you on the list. I have an assignment for you, Mitesh. Yeah. So we started raising money 14 years ago, and we began to fund young investigators, mentored young investigators, pilot research, and other innovative research. This is what got Bonnie started. In fact, we were working with the Rudy Schulte Research Institute more recently, but the Finlayson family from the very beginning. And we have raised over $14 million. We've turned that into research, and our researchers have gone on to get another $74 million of additional grants. So I think we know how to pick them, because they're going on and being really, really successful in their work. And just here on the right side, you can see what we've done. 61 research grants, biobanks, the research networks, a couple of NDAs and so forth. So yes, it has indeed made a difference. So here it is again. And it's kind of old, it's stale. It was made in 2005. I don't dare ask how old this side of the room was in 2005. But look at the 4. Thanks. That's me plus 61. Or on that plus 61. So, but look at the scope of it. And I want you to think about all of the work it represents, all of the ambition, all of the discoveries that are there. And if you are young, you who were just 4 years old 20 years ago, you may be saying, oh my gosh, how am I going to stay on top of this? How am I going to follow injury and recovery mechanisms and neural networks and AI and so forth? And how can you stay current? And I'm going to tell you that you can. And the one thing I want you to know is I was junior when I first drew this. I had just made the jump from assistant professor to associate professor. So I was youngish. I was just out of the junior career. And so you can do it, but you have to develop good habits. And the way that I did that was to constantly, incrementally update my knowledge. I didn't try to do it all at once. I said, let me use PubMed and let it do the work for me. So this is the search that I set up a long time ago. And for probably more than 17 years now, every Sunday I get an email from PubMed that says, here's the most recent hydrocephalus literature. It's actually looking back at the last 180 days, but because I get it every week, it's really telling me what's 180 days a week ago, or a week ago, 180 days. But I get 25 to 75 new papers per week on that list, depending on the list. Now, I don't read them all. I got other things to do with my time. And I find and save about 5 or 10 papers per week, but I've seen the list. I know everything that's out there. And so that helps me in case I hear of something in the future. And this is just a sample from 1 week last summer that I collected. So here it is again. And the science has changed since I first created this. It's been 19 years since I created it. And many people who are in this room have helped to make that happen. Well, the science is advancing, and that means that the mandala needs to change as well. So I've updated it. And this is the new version of the mandala. And if you want to see how they compare, let's put them side by side. And one critical change that I made was up at the top in the middle, I put brain water dysfunction because it really is a brain circulation disorder that instigates everything else that follows. And I made this change after attending a conference in Copenhagen with Nana Macaulay on brain water. But we now have genetics in there. We have complications and comorbidities in there. We have gravity physiology, because I certainly am learning in my work with NASA that if you think you understand physiology, take gravity out of the equation and you don't know what you're talking about at all. And so what I want to do next is actually show you what's changed in the research. So a year after the NIH workshop, we had the first big meeting in Gothenburg hydrocephalus meeting. So this was 2006, and this is actually before the white paper was published. And I went through the abstract book and started to make a list of things that we're talking about now in the science that we didn't have in 2006. So I've got a lot of categories here. Look for the zeros and the ones. Those are the areas where essentially nothing was happening. Aquaporins, glymphatics, brain water transport, cellular and subcellular physiology of microglia, inflammation, mitochondria, novel chronic animal models of hydrocephalus, genetics. We've learned so much more about genetics, patient-centered outcomes, health economics, gravity, registries, research networks, training the next generation of specialists, which is a bigger challenge in adult hydrocephalus than in pediatric hydrocephalus. And if this is the progress that we've made in the 17 years since the Gothenburg meeting, imagine what it's going to look like 17 years from now. So we created a new vision of hydrocephalus in 2005, and all of these things that weren't there are now on the radar screen, and we made that happen. So I use the mandala all of the time. It really is fully integrated into my thought processes, my reasoning, and my being. And when I see patients, I try to see the world through their perspective, their hopes, their fears, their goals of care. And I see patients from age 18 all the way up into their 90s. And when I take care of them, I look beyond the horizon. It's not just, oh, well, shunt's obstructed, fix that. I call that the forest fire model, Mitesh. Everybody's putting out fires, but nobody's asking why are there so many fires? I look beyond the horizon. It's not just to take care of them this week, but to keep them well all the way through. And when I work with my colleagues, I think about their perspectives. I understand or try to understand the neurosurgical perspective, adult and pediatric neurology, neurosurgery, neuropsychology, rehab specialists, basic scientists, physicists, clinician researchers, policymakers. You have to understand how everybody who's represented in the mandala thinks about hydrocephalus. Their views are important, and you can incorporate that into your own thinking and reasoning. So when I listen to your presentations, and I did that this morning in Bonnie's lab, or when I peer review grants and papers, I'm thinking about the mandala and thinking about the significance of the work. And I incorporate that into a mission and a vision. So you start with a vision, and mine is that every patient with hydrocephalus at every age and every stage of life should mature and advance successfully to the next stage of life. You like that mission, Kyle? That's a good mission for hydrocephalus vision. And that sets up our mission. And it's mostly a clinical mission here, but I'm going to tie it all together in just a second. So when we see patients with hydrocephalus, our mission is to provide the care they need to get them through the entire lifespan. So when I get an 18-year-old in my clinic, I'm thinking about getting them to 78, not just to 19. And that becomes not an academic triad that everybody talks about, but it's an academic tetrad. And I encourage you to change from a triad to a tetrad, not patient care, teaching, and research alone, but advocacy. The Hydrocephalus Association advocated for us, we advocate for them. We wouldn't be where we are today unless we had participated in advocacy with the Hydrocephalus Association over the last 20 years. So where's IU on the mandala? A bunch of different places, I'm happy to report. So there's Bonnie Blaser Yost's work to develop medical therapies, along with Terry Bellicky Adams and Lauren Jancy, and they're all working together. Tim Bentley talked about the large animal model. Jignes Taylor presented work on ETV. Is he still in the room? There you are back there. There's some interesting stem cell work you could be doing in hydrocephalus. We're going to pull you in for that. We mentioned the NIH trial and so forth. Kyle, I think your story speaks for it itself, and the Hydrocephalus Association is here for you. And so I would say that Indiana University is ahead of most other centers. I'll tell you, at University of Washington, I don't have a group like you. Ours is predominantly a clinical program. So for the young people, I encourage you to appreciate the people, the specialists and the researchers on the mandala, to appreciate the patients, whether they're neonates or children, adults or the elderly, and their families, to appreciate the setting where the work is done, academia, community hospitals, resource-constrained settings. And I think the work of Steve Schiff was amazing to me, unraveling what's happening in resource-constrained settings in Uganda. And I want you to recognize where you exist in the mandala, how your talents and work fit in and contribute to the overall goal, to recognize the opportunities to work with others, and to recognize how apparently unrelated research, like renal physiology research that Bonnie Blaser Yost was doing 8 years ago, is in fact relevant to hydrocephalus. And I encourage you to envision and create the future of this mandala. Create your own mandala. You can start with mine if you want, I don't mind. Use it for introspection and meditation. Strive to know the entire mandala, incorporate it into your being. And if you do that, then I'm really optimistic, because I know that in this room, there may be the person or persons who are going to discover key biological mechanisms for reversible neuronal and glial injury and recovery, who might discover the biological mechanisms of brain, water, and CSF regulation and flow, who might lead the first clinical trials for drugs or biologics to treat hydrocephalus, who will figure out the biocompatibility of shunt catheters to make them better, and who might discover better biomarkers. And there might even be somebody in the room who discovers cures for the prevention and treatment of hydrocephalus. And lastly, for the young people in the room, there might be somebody standing here in 25 years at the anniversary of the program giving a keynote speech. Thank you.
I think Mike and Bobby's